With that, I would like to invite our next speaker, Jonathan Gaev. Jonathan Gaev is International Engineering, Senior Manager of International Engineering Device Evaluation at ECRI, and he likes to do everything twice just to make sure it's done correctly. So he did 2 bachelor degrees. He graduated with 2 master degrees in addition to being certified clinical engineers. And if that's the trend, Jonathan, I bet you like the Texas 2 steps dance, as it has too as well. I invite Jonathan to talk about the vaccine distribution and specifically the related medical technology that clinical engineers will have interest in. Jonathan?
Thank you very much, Yadin. It's a pleasure to be here. I've been at ECRI for over 27 years. That's a long time, working in the device evaluation group. We've expanded our testing now to include the testing of equipment that's not sold in the USA. In order to do that, we had to open a testing lab outside the USA. I've been managing that lab or contributing to management of that lab in Malaysia for a couple of years. So I'll talk first about the equipment that's involved with the vaccine administration, and then I'll share our experiences with vaccine distribution in the United States. So first thing you should do, I know I'm speaking, a lot of clinical engineers are on the line here. So the first thing to do is to check with your team about what type of equipment your clinicians feel should be involved with their vaccine administration. You've probably heard that there are a lot of concerns about allergic reactions after the administration of the vaccine. Patients usually wait 15 minutes to 30 minutes, and there's some monitoring equipment that might be helpful. A pulse oximeter, you know that COVID patients can arrive with low SpO2 and they don't feel it. That's quite a clinical puzzle. In a lot of places, they use some sort of IR temperature screening on people, and you have to take care when you're using IR thermometers. Remember, they were developed for use inside. The IR thermometer is expecting internal temperatures. When COVID first started, I had a colleague in Detroit, Michigan. That's very cold there in the winter. And they had the patients lined up outside and they would be screening them. And they recognized immediately that their IR thermometers were not working well. They were giving very inaccurate results. So they then had to change the system, either screen people in the lobby or create tents outside where the temperature could be closer to an indoor temperature. So if you're using IR thermometers, especially if you're using them outside, watch out. Another device is blood pressure. So if you're using standard blood pressure techniques, where a nurse or a doctor uses a device and listens to the arm while they're taking the blood pressure, not so much for you to do. But if you're using an automated device, an automated device, then you want to check that with the clinicians first. What I mean to say is you want to check your automated device against the manual method. I have personally tested several of these automated devices, and I found that either the systolic, the upper blood pressure, was incorrect, or the diastolic, the lower, was incorrect. Some physicians tell me, well, I only care about the systolic, so this device is okay. You want to work all that out before you start your administration. You don't want to solve these problems with a big line of people watching you. In order to get heart rate, the clinician will need a watch or some sort of timing device. A lot of time that's on the pulse ox if you're using one. People want to have oxygen available for patients during that period in case that's required. Now, if you're next to wall oxygen, then great, you don't have to do much. But if you're going to use portable oxygen, remember that's a pressurized cylinder. You don't want that dropping, you don't want that rolling around. It has to be contained in some way, requires a stamp. Of course, you need sharps containers. You might need a telephone or a cell phone in order to communicate with emergency medical services if you need that. So you want to make sure your phone's working and that you have good cell phone reception. I'll talk about the Pfizer vaccine a little later, but the boxes that the Pfizer vaccine come in, after you fill them up with the dry ice, they're kind of heavy, over 36 kilograms, 81 pounds. So you might need a cart in order to move those around. Next slide. So the USA is a fairly large country. It's geographically large. So we have to distribute vaccines. Now we're handling this a lot differently than we handled what we did before. So the US federal government is the sole purchaser of vaccines in the United States. So the federal government buys it. We don't have this competition between different states in order to buy things. And the federal government distributes vaccines to each state, each of the 50 states in the US, and then each state decides how they're going to distribute it. So right now, the way that's handled is the states are distributing that to hospitals and then later to some of our large pharmacies. And a private company, McKesson, is handling the logistics of moving the vaccine and also handling some of the equipment required, but not the equipment I discussed to you. They're not sending people pulse oximeters or non-invasive blood pressure. Next slide, please. Now, all vaccines have to be stored at a certain temperature. Pfizer, Moderna, AstraZeneca, they all have to be stored at some temperature that's different than room temperature. So if you're storing something at a specific temperature, it makes sense that you would have to monitor the temperature. So when I say monitor the temperature, ideally you would monitor it very regularly, let's say every 30 minutes, and have an automatic log. You're not able to do that if you're measuring it a couple times a day, let's say the beginning and the end of each shift. That would be satisfactory too. Now, since temperature is important, wherever you're storing these vaccines, something could happen. You could have a power outage, or you could have some kind of problem where the refrigerator or freezer is not going to be able to maintain the right temperature. If that happens, you want to have a plan. Frankly, you want that plan before something like that happens. So you want to know what you're going to do if you have to move the vaccine. Now, by the way, if that vaccine is exposed to a temperature outside of the storage requirements, you don't immediately dispose of the vaccine. You isolate those vials or that part of the vaccine that has been exposed to that inappropriate temperature, and then you contact the manufacturer for advice. And you can see that if you have good temperature records, meaning more frequent temperature records, you're going to be in a better position to respond to the manufacturer and their concerns. Next slide, please. So let's talk about the Pfizer vaccine. That's the special one. That's the one that requires an unusually cold temperature if you're going to store it for more than 5 days. So hear me. The amount of time that you need to store it is quite related to the storage method that you have. So the CDC in the US and ECRI, we do not recommend buying ultra-low temperature freezers only for the purpose of using them for the Pfizer vaccine. You would need that if you're storing something for 6 months. 6 months is a pretty long time. If you don't have an ultra-low temperature freezer, Pfizer provides thermal shipping containers. Those are like coolers, and they can be filled with dry ice. You have to add dry ice every 5 days to them. So if you do that, you can store them in that thermal shipping container for up to 30 days. After 30 days, you could move it to a refrigerator for 5 more days. So when you add everything up, without an ultra-low temperature freezer, you can store the vaccine for 35 days. That should be a decent amount of time in order for you to administer your vaccine. Now, those thermal shipping containers, they do come with a temperature monitor. And that temperature monitor sends a signal to Pfizer. And then you can put in up to 4 email addresses. You'll receive a text regarding the temperature status, and you'll certainly receive a text regarding any out of temperature limits. So you need a good internet connection. Wherever, if you're using those thermal shipping containers, you need to store them in a place where you have a good internet connection, because that's how that temperature is being monitored. Okay? Next slide, please. Now, I mentioned that you'll be using dry ice. So you want to handle that properly. You know that dry ice is CO2. So since it's CO2 that displaces oxygen, you want to have good ventilation wherever those containers are stored. When you handle the dry ice, you want to protect yourself well. You want a face shield and you want cryo gloves. When I say cryo gloves, these are gloves that can handle that temperature, not just exam gloves. Okay, for sanitary purposes, you could use exam gloves inside the cryo gloves. That's okay, but don't think you'll be safe if you're only using the exam gloves. Next slide, please. I know I've covered a lot of ground here. I want to summarize what I've said here, but the first thing I want to say is something that's been a little surprising for me when I've done my research on this topic. This is a topic where information changes pretty quickly. As our other speakers have said, these vaccines are new. We're learning about them. So this isn't like medical equipment where maybe you know how a pulse oximeter works or a ventilator works and then you're done. Even during a several-week period that I've been doing research, I've noticed that even the vaccine manufacturers themselves have made slight changes. So we're giving you up-to-date information here, but when you're getting ready to prepare yourself for work at your hospital or your facility, check for updates. So all vaccines need to be stored at the right temperature. So you want to have a way to monitor that temperature, and you need a plan in case wherever you're storing it is not able to maintain that temperature. It's not like the flu. If you're used to preparing yourself for the flu, notice for giving flu vaccines in your hospital, notice that you need a bunch more equipment, and that's because of those allergic reactions. So if you're using non-invasive blood pressure, if you're using automated NIBP, you want to make sure that you've already checked that. You want all that equipment calibrated in good working order, make sure that it's used properly. You'll need pulse oximeters, non-contact IR thermometers, and oxygen. And if you don't have oxygen right next to where you're giving the vaccine, you need gas, oxygen cylinders. You need a way to secure that. The Pfizer vaccine, you're going to need dry ice if you're going to store that more than 5 days. In the US so far, we haven't seen shortages of dry ice, but you want to check with your local supplier. You can store that in Pfizer's container for up to 30 days, changing the dry ice every 5 days. Then you can put it in a refrigerator for 5 more days. You want to handle that dry ice safely. You need a face shield, cryo gloves, and proper ventilation. For the Moderna vaccine and for the AstraZeneca vaccine, you don't need special equipment. Your freezer or your refrigerator should be satisfactory. Thanks everyone for your attention. I really appreciate it. Thanks for the opportunity to everybody for ECRI to participate and share the information that we have with all of you.
Thank you, Jonathan. Great connection and engagement of clinical engineers with the discussion about pharmaceutical and biology that we're taking so far. And now we got the clinical engineers back into the circle. And if you can take a look at the question, Rosanna from Peru has specifically a question for you. If you can address that, that would be great. Again, thank you.
Glad to do it.